Hello, I'm Senator Rod Grams, and welcome to the June edition of our Washington Report. Now, whether it is medical technology, the high-quality services available to patients, or the professionalism and expertise of our nation's healthcare workers, our country is blessed with the finest healthcare system in the world. And thanks to our renowned hospitals, clinics, and medical device manufacturers, Minnesotans are fortunate to have the very best right in our own backyard. However, for all of the strengths of our healthcare system, we do need to address the rising costs of prescription drugs, access to affordable health insurance, and how to protect and strengthen Medicare. And as Congress tackles these concerns, we must ensure that we always keep the most important decisions about health care right where they belong, and that is between the patient and the doctor. I'm confident we can work to make health care more accessible and effective without undue government interference. Now, we're going to discuss these and other topics with my guest today. And on our show, he's a world-famous heart and lung transplant surgeon and the only practicing physician in the United States Senate. He is Senator Bill Frist of Tennessee. And Senator Frist, thank you very much for taking time to join us on our program today.
Rod, great to be with you.
Thank you. Now, you're in, as I mentioned, kind of a rather unique position in the Senate in that you are a practicing physician, in fact, a transplant surgeon. So how does that experience really play into your efforts when we're talking about Medicare, the health care bills and programs, and also the reform issues that we're talking about?
Rod, the one issue, as you and I have talked about so many times, that affects everybody listening, watching tonight, every United States member of Congress, the President of the United States, is health care. It is also one of the most expensive aspects of our everyday lives, clearly of our federal and state governments. So to me, it makes sense to have at least one person in the United States Senate who has taken care of patients, who spent thousands of hours in the hospitals, who've been involved in what you just mentioned, that doctor-patient relationship on an intimate basis every day, which I happen to do for 20 years. Thus, when we address Medicare or health care for our seniors, or prescription drugs, or organ transplantation, or that doctor-patient relationship in terms of medical record privacy, it is important for me, having been so intimately involved in those situations, to express the realities, the great healthcare system that we have today, but also the real challenges that we have of the future. And I find my voice in the United States Senate to be that reality check day in, day out.
Now, the fact of the reality is your contact with the patients, you know the daily problems that they face, whether it's before the surgery, after the surgery, the care, the shortcomings of the healthcare system itself. But one of the other important aspects, I think, of your experience is also dealing with the tremendous paperwork involved. And when we talk about streamlining this, we want to make sure that the programs are the most effective they can be so that you can spend more time with the patient, with that relationship, rather than spending a paper relationship with the federal government and the programs we have. So I think that's a unique perspective you bring as well.
And I think it is a voice that's important for people to understand. When you as a patient go into a doctor's office, to realize for that 5 minutes, 10 minutes, 30 minutes that they spend with you, there is anywhere from 2 to 3 times that amount of time that he or she has to spend in terms of filling out forms for the federal government, for the state government, for the HMO, for the managed care. Therefore, our efforts need to be to remove that red tape and get it back to patient care. And we've made some real positive strides, but we have a lot more to do to streamline this system.
Now, I know you're also very concerned about the solvency of Medicare. Paperwork is one thing, and you know, I think everybody would agree that we would like to have the doctor's ability to spend more time with the patients, because that's what's the important part rather than the paperwork, but also the insolvency. Do you feel the system needs to be reformed? And I'm talking about Medicare now. I mean, we're going to talk maybe a little bit about the insurance problems other than that, but do you think the system needs to be reformed in order to preserve Medicare for future retirees? And if so, how?
Well, there's no question that if we stay on the current course today, that in 15 years Medicare simply won't be here as we know it. And I can tell you as a physician that health care security for our seniors really needs to be what the definition of Medicare is not there unless you and I act, and we act responsibly. It can be done, we use the word solvency. What that really means is a good, strong, integrated healthcare system for our seniors. It's not going to be there for 2 reasons. First of all, technology. We are blessed with these tremendous advances which mean better quality of care, but they're expensive. But number two, there's this huge demographic shift that is reflected in Social Security, in Medicare, where we have a doubling of the number of seniors. Medicare is like a big cash drawer. People are paying in every day and they're paying out every day. And as you double the number of people who are taking out, it can't be sustained unless we act. There are things that can be done. Make the efficient more streamlined, more efficient, more comprehensive. If we do that, Medicare can be sustained long term.
What about the debate? It kind of surrounds Social Security as well as Medicare, but all we have to do is raise the premiums. In other words, raise the payroll taxes, and Medicare is fine. So I guess, Bill, I'd ask you, if we step back, is the system, now it's 35 years old.
Yeah.
A lot of things have changed in 35 years. Does the system itself need to be reformed before we just say, let's throw more money at the problem?
There is no question in my mind that by reforming the system, and by reform, it's scary to some people when you say reform, we're talking about modernizing the system. People don't realize today's system is out of date. In 1965, heart transplants weren't done. Lung transplants weren't done. Coronary artery bypass surgery, one of the most common operations, was not done when Medicare was designed, yet Medicare has not changed. It's incomplete, it's not comprehensive, it does not include preventive medicine today, it does not include prescription drugs today. It's incomplete in that when you're a senior, on average, only 53 cents on the dollar is going to be paid for by the federal government. You're going to have to scrape around to come with the other 47 cents. By integrating the system, modernizing the system, reforming the system itself, we can improve quality, ultimately lower cost, and guarantee health care security for our seniors long term.
And like you say, things that were done in common practice in 1965, now we move to the year 2000, and many of the new devices, for instance, I have a St. Jude medical valve,
yeah,
and that wasn't available then. But even some of the prescription drugs, and now to move them into the system is very hard to get approval from Medicare. So many of our seniors today are being denied maybe some of the latest technology just because Medicare is a little bit behind the curve on accepting this. So is that part of what we're talking
Yes.
about, streamlining?
And it
replace the old with some of the new.
That's right, which improves quality, improves access, better health care security for
cost.
seniors, and lower cost.
Yeah.
Now, why lower cost? It really ties with what you talked about in the opening. Internal Revenue Service paid our taxes back in April. It is governed by about 45,000 pages of regulation statute. If you look what governs the doctor-patient relationship, with paperwork, the requirements, the mandates, it's not 45,000 pages or 90,000, it's 135,000 pages of regulations. In that 135 pages, there's confusion, there's fraud, there's abuse, there's waste, there's red tape, there's paperwork. So what we can do is simplify that system, simplify that doctor-patient relationship and hospital-patient relationship, and that will automatically lower the cost, improve that quality of care, and improve access over time.
Doesn't the Hippocratic Oath just about sum everything up?
That's right.
I mean, in what the whole 135,000 pages are trying to do, and that is doctors want to provide the best possible care that their experience can give. But it's the regulations, and really I think a lot of the doubting in Washington that they can't trust doctors or the system to deliver the best care unless Washington is standing over the shoulder of the physician.
Yeah, the one-size-fits-all mentality out of Washington results in a tremendous amount of waste and fraud. There are right now 10,000 different codes governing that doctor-patient relationship that are interpreted in 3,000 different communities across the country. Obviously, with that much regulation, that much bureaucracy, all written here in Washington, D.C., you end up having inefficiencies which ultimately translate into less than the sort of quality of care that our seniors deserve.
Now, you and Senator Breaux of Louisiana, in a bipartisan effort, have introduced a reform package. And I want to talk a little bit about that and then expand on it a little bit. But maybe you'd want to go over a little bit of maybe some of the problem areas you see in the current system, how your bill relates to those, and is there any private sector incentives trying to be built into this government program?
Well, this modernization of Medicare, the so-called Breaux-Frist proposal, it is a bipartisan proposal.
I like Frist Breaux, but that's
Frist
fine.
Breaux, I know, that's right. It actually came out of a year and a half of study with the National Bipartisan Medicare Commission, appointed by the leadership in Congress and the President of the United States. We studied it, we brought in experts, we had a series of hearings around the country, we looked at what other countries are doing, the best of what America has done in the past, and we came up with a proposal. We had a majority vote, but unfortunately the President pulled his 4 votes, And therefore, even though we had a majority, we didn't have enough to recommend specific
Because you
legislation.
needed a supermajority.
We needed a supermajority.
Which is 60% of those.
That's right, and which is discouraging, yet what we turned around and did is took that model, premium support, based on the private sector model where you do have competition, you guarantee all the benefits that people get today, and it's based on the way you and I get our health care today, the way the president gets his health care. It's called the Federal Employees Health Benefit Plan. We have a 40-year history with it. Today it serves 9 million people, so we have that positive experience with it. It includes things like prescription drugs, which Medicare today does not, on an outpatient basis, include. It takes care of all the inadequacies of Medicare today. It has preventive health care. Medicare today does not. It has prescription drugs. Medicare today does not. It has choice, so you can choose a plan that meets your needs today. Right now, Medicare has very few plans available. I'm very optimistic about the plan long term. It's going to take a lot of hard work, but it does address, I believe, in a common sense, modern way, how to address the reform of Medicare to guarantee that health care security for seniors. And also, I should say, everything we're talking about applies to individuals with disabilities.
And now, just so the viewers don't get confused, that we don't have a special plan. I mean, there's nothing carved out that is giving federal employees or senators or the president something special, because basically our health plan is off-the-shelf policies that would be available to anybody, could be available to anybody, whether it's Blue Cross Blue Shield, which I happen to have, but others that might be out there. So we're not talking about anything special. I mean, a lot of people might have the perception, oh, Congress is taking care of itself. All we have been able to do and pay a portion, the government pays a portion of our plan, just like an employer would for anybody out there, but these are off-the-shelf policies. But as you said, it gives a lot of choice and not the restrictive things that Medicare does today.
And it shows the inadequacy of Medicare today. You're exactly right. These are private sector plans that you and I can choose from, like employees can choose from who work for businesses with employer-sponsored plans. The only people who don't have access to those plans today are seniors.
That's right.
And that's why this bill, I believe, is important as we modernize the system to make sure that seniors have access to the very same care that the rest of the world has access to.
And they can also kind of shape the plan that best suits them. Again, one size fits all. You might be in the same age category, but you could be single, you know, you could be living in different parts of the country, you could have different health problems. Everybody is different, and this would also help them tailor a plan better for them, suited for their needs.
That's the really exciting thing. Like, I did heart transplants before coming to the Senate. If I have a patient who had a heart transplant, he or she could pick a plan that has the sort of benefits that make sense for the chronicity of care for heart transplants. Other people might want to pick a plan that specializes in long-term care because they may have chronic rheumatoid arthritis, which is debilitating. Others might take a plan that specializes in mental health services. Right now, they don't have that choice today. Under our proposal, they would have that choice, and at the same time preserve, sustain Medicare long term.
What about medical savings accounts? And I don't know, we can go through this, but I think a lot of people understand that these are kind of like an account you can put money away and use this to help with your health care. But are medical savings accounts part of your proposal?
Medical savings accounts are. There's a pilot program today that is limited because it's going to go away in 2 years unless we reauthorize that in Medicare today. The medical savings account, which gives you personal savings account control over that money, coupled with the catastrophic insurance policy, is probably the most empowering because the individual has choice. Whether they want preventive care, what doctor to choose, what hospital to go to. Right now, they're a very small part of Medicare. In the future, I believe they should become, if someone wants them, not forced into it, if they should want them, an important part of Medicare.
Now, where is the opposition and what is some of the reasoning behind it? It seems like what is being offered in your plan of reforms is basically choice and options. Medical savings accounts, different health care plans, tailoring the need for my specific concerns. Where is the opposition? I don't know there is some, but to give them, you know, why are they concerned about allowing this type of freedom for our seniors?
Well, it's interesting. People who fundamentally believe that Washington, D.C., with a one-size-fits-all approach can do a better job than individual plans competing with one another, maximization of choice. If your approach is that mentality, you're not going to like the Frist proposal because we really do go down to that individual. There are fear tactics. There's demagoguery. We call it the sort of this Medicare scare tactics that are out there, which I think is really unfair, that does a disservice to our seniors and individuals with disabilities. This resistance to change, that any change means taking away something. The beauty of our plan, that we guarantee that either you can stay with what you have today, or if you want more choice, you can come in and choose this. Both guarantee exactly the same benefits you have today.
So in other words, you can stay with the current system if you're unsure about it or prefer that, or you can take and have the choice.
Absolutely.
Now, as you mentioned, the President really pulled his support during the commission. Is the President still opposed to this plan, and if so, to what degree?
Well, an hour and a half before, and this was really disturbing to me because this is bipartisan. Remember, bipartisan. Public sector, private sector working on this commission very hard. The President, an hour and a half before the final vote, said that he does not support the recommendation by the commission because he is going to come up in the future. Remember, this was about 9 months ago, with his comprehensive reform of the Medicare plan. Well, we have not seen that to date. He's going to be out of office in 6 months. In the meantime, we have done nothing to help our seniors. We've done a real disservice, I believe, in terms of guaranteeing that security long term.
Any optimism about having this passed this year?
This bill will not pass this year. The number of legislative days means it will not. An important element of this bill, the prescription drug coverage, I believe we can make real progress with. Again, as a physician, I feel it's critically important that prescription drugs be included in part of a seamless Medicare proposal. This year, I believe we will be able to approach at least some of that prescription drugs. Overall reform we will not accomplish this year, although people realize that this is the direction, the template that will be used in the future.
I want to talk about prescription drugs, but we're going to take a break right now. We'll be back with our special guest, Senator Bill Frist of Tennessee, in just a moment.
The average kid doesn't get straight A's.
The average kid could live on french fries. I could live on pizza and ice cream. Gummy bears.
The average kid trusts their friends more than anybody.
The average kid is totally bored.
Totally bored.
The average kid has a lot more on their mind than you think.
The average kid is pretty strange.
The average kid has been offered pot.
The average kid thinks everybody else smokes it, but the average kid doesn't.
The average kid is anything but.
It's my birthday! Oh, it's so pretty! Oh, I told you! Don't be bringing that weak stuff in here! Yeah! Who's the man? Who's the man?
Exercised lately?
And again, thanks for joining us on our Washington Report. Our special guest is Senator Bill Frist of Tennessee. Again, Bill, thank you very much for being with us.
Thank you, Ryan.
Just started talking a little bit about prescription drugs. We touched on it earlier in the program about how they have become more important in the healthcare system itself. Preventative health care, more independence, freedoms. But how important is it to get a prescription drug bill passed this year? Now, I'm looking at it from a couple of points of view, of course, one for the patient and then also for budgetary. I think there's real savings to be made. There's a better lifestyle for those who need it and also for the patients themselves. Where do we stand on the prescription drug bill this year?
Well, you know, it's been fantastic as a physician to follow prescription drugs and advances in the pharmaceutical industry development over the last 30 years. 30 years ago, we didn't have the medicines that we had today. When my dad practiced medicine, we didn't have it. Today, these medicines are revolutionary. They keep people out of the hospitals. They replace the stomach ulcer operations we used to do. Our seniors deserve that coverage. We in the United States Congress passed a budget which basically says over the next 5 years we'll spend $40 billion on a prescription drug benefit, though that benefit does have to be coupled with some of the Medicare reform that we talked about in the last segment. Therefore, I'm very optimistic. Through your work, and you have a fantastic bill that is out there on the pharmaceutical coverage. I have a very similar bill. I believe if we can couple those bills with some reasonable first steps for Medicare reform, that we will see a Medicare prescription drug package for seniors and for individuals with disabilities this year.
And the bill I've introduced called Meds, it's similar to yours. It deals those who need the help the most. Many that have to make a decision between food, shelter, and their prescriptions. We shouldn't put them in that situation. But at the same time, for those who can afford their medicines, we shouldn't be paying either. The president, he throws a blanket over everybody. We need to target those who need the help the most. But what are the chances, or can we go ahead and pass a prescription drug bill this year without the reforms that you're advocating in Medicare? Can the reforms play catch-up? Is it important to take this step at least, if not the reforms this year, and then try to play the catch-up on the reforms next year?
The danger of passing just a prescription drug package, which will cost $40 billion, at least initially, but could run up to as much as $200 billion, is that if we don't address the overall solvency of Medicare, putting that additional benefit on Medicare would sink that ship even faster. I think what will happen, and what I will fight for, just as you and I have discussed, is to take a prescription drug package, hook it to some initial reforms. For example, have a Medicare agency oversee Medicare instead of having HCFA, Healthcare Financing Administration, with its one-size-fits-all, heavily bureaucratic approach. Link it to some modernization of HCFA, which will allow it to compete in the marketplace, to modernize HCFA. If we can link that prescription drug package to, for example, those two initial reforms, it will allow us to take a first step to reforming, improving, modernizing Medicare long term. And I predict that if we're successful, that's what will happen over the next several months.
Now, do you think those reforms could be passed this year? I know we don't have a lot of time left, but these are so important, and the debate should be really focused and moved. But do you think those are possible this year?
I believe those are. Those are very modest first steps that, for those people who understand that the long-term sustainability and security of Medicare are dependent upon reform. Those, for example, those two that I mentioned are issues that can, and I believe must be passed and hooked on to this incorporation of prescription drugs in healthcare today.
We're going to take another quick break right here. I want to talk to you about the Patient's Bill of Rights. That's also in conference right now when we come back. We'll be back in just a moment.
Over 2 million acres of our wildlands burn each year, and hundreds of homes are lost as a result.
At least 50 homes were burned to the ground. Dozens more were damaged as fires raced through dense brush and steep canyons.
Flames don't know the difference between forest, rangelands, and homes. Learn how you can fireproof your home. For more information, contact your local fire protection agency, state forestry office, or the USDA Forest Service.
Again, thanks for joining us on our Washington Report. Our very special guest today is Senator Bill Frist of Tennessee. Senator, again, thank you very much for joining us.
Thank you.
A lot of experience and background in medicine as you've practiced it, as you've mentioned, for over 20 years. You've been involved heavily in the debate in Congress since your term in the Senate. Really have led the efforts, I think, and have been one of the shining stars in Republican efforts to reform, streamline, and improve a lot of the things dealing with Medicare, prescription drugs. One other important bill you were very active and worked very hard on is the Patient's Bill of Rights Plus Act. Now, this was the debate that's been going on for a couple of years. Senator Ted Kennedy had his Patient's Bill of Rights. We had a bill called the Patient's Bill of Rights Plus. Similar bills now are in conference. What do you how do you see the outcome of a possible of getting this out of conference this year?
Yeah, Rod, we are in conference and we'll be working on it today and over the next several weeks where the House and Senate versions come together. I believe we will have a bill. It'll be sent to the President. I'm very hopeful that he will sign that bill. The basic premises that I use in the conference and on the floor of the United States Senate are, number one, to return as much decision-making as we can back to that doctor-patient relationship. As a corollary to that, I think it's important not to have the HMOs making medical decisions.
That's right.
Clearly there's a role for better management, better coordination in healthcare today, but get them out of the business of making the decisions that's more appropriately made between a doctor and a patient. And thirdly, a principle that I've stressed is that we don't want to have unnecessary mandates that drive the cost of health care up unnecessarily. Why? Because that, by definition, drives people to the ranks of the uninsured. If people can't afford their health care insurance, they just don't go out and buy it. So those three principles I continue to use in conference, and we will, I believe, send a bill that the President can and should sign to improve health care for every American today.
One of the big efforts is to keep, the patient-doctor relationship and not have HMOs or insurances making those decisions. But at the same time, we don't want an attorney in the exam room at the same time, in which the other bills have proposed. In other words, opening the door to more lawsuits. It would drive up the cost of health care, but it wouldn't go into medicine. It would go into legal terms in lawyers' pockets. So that's another important part that we're trying to get done as well.
It is, and it's interesting because clearly you have a lot of the trial lawyers, even a lot of the medical profession saying, yes, you should be able to sue. What they miss, and this really comes from a lack of understanding of what really goes on. When somebody has a sick child, they want to take that child to a doctor and have that child taken care of. The care that that child deserves, have it delivered. They don't want to go out and sue or have a lawsuit. These lawsuits aren't settled for 3 or 4 years later. A lot of the trial lawyers walk off with 50% of the money. So the heart and soul of the bill in our Senate version and ultimately in the final bill is to have that care provided. Strong internal appeals. If they still disagree, a strong external appeals where that mother and child can go to somebody, another doctor outside, and whatever that doctor decides is binding. If you can take care of that strong internal, external appeals process, a child will get the care when they need it, rather than resorting to some lawsuits 3 or 4 or 5 years later.
Right, to deny care and then sue, you might have a good case, but you don't have the result that you want.
That child
That's right.
deserves that care.
Couple of quick areas before our time runs out. We only have about 2 minutes left, but one area is, of course, investing in research, NIH research, biomedical research. How important is that? I know we've made an effort to try to double it over a 5 or 7 year period of time, but very important we take the lead in trying to improve research in medical areas.
One of the most gratifying fields since you and I have come to the United States Senate is to see this course of doubling of NIH, National Institutes of Health. That's where our primary healthcare research in this country is done today. We're right on course. We've done it for the last 3 years. It's critically important. It's a investment today for tomorrow. Politicians too often think short term. This is one of those long-term investments that 100% of the time will have a payout.
And one final thing, you're a very noted heart surgeon, transplant surgeon. The owner or the organ donor program, very important. What would you stress as far for our viewers today is the future of that and the importance of that program?
Well, I have transplanted hundreds of people. The miracle of transplantation can continue to be provided if we better educate people broadly. Organ transplantation work, there's a huge demand, there's a limited supply, but that supply can markedly increase if everybody tonight talks to their family, signs an organ donor card, tells their loved ones that they would donate if there were a sudden and unexpected tragedy. That will revolutionize the application of transplantation today.
It's a simple procedure, but it's one that it could save many, many lives. So it's not hard to sign up or where can they get information about it?
The best thing, you can call your local hospital and they will send you information there. Your local organ donor organization will do that. The most important thing is to talk to your family and tell your loved ones that yes, if something happens, I will be an organ or tissue donor.
All right. Well, Senator Bill Frist, thank you very much for taking your time to join us. We appreciate it. And also we appreciate all the work you do in the Senate leading, I think, the debate and the charge on taking care of the health care and where we go in the future.
Thank you.
Thank you very much. Thanks for joining us. We'll be back again next month. Good day.